the Senior Healthcare Data Scientist at Blue Health Intelligence. He's also a faculty member within the Department of Biostatistics at U of I Chicago, and he's a lecturer at Stritch School of Medicine, Loyola University in Chicago. And of course, last but not least, we have Dr. Erik Widman. Erik is an AI product owner from Solstice, and he has a lot of experience in technology consulting that serves Fortune 500 clients within the AI space. He is also an expert in artificial intelligence and conversational UX. Before working at Solstice, he had worked for 10 years within the biomedical industry. Thank you so much, everyone.
Yeah, I think, I really appreciate Sarah and come back. We used to work together for our previous conference. And for this panel, we will focus on healthcare industry and also a little bit data-driven marketing. First of all, I would like to maybe we can introduce yourself a little bit, your background, and also some project you used to work on. I would like to start from Katherine. Thank you.
My name is Katherine Tong. I'm a data scientist currently at Pareto Intelligence, which is a small startup within a larger management consulting firm called Healthscape Advisors. Prior to that, I owned my own business and was doing contract work for a while, C2C, with different companies. I worked in retail for a bit. And then I was a data scientist at GE Transportation. And then I also received my master's in analytics from University of Chicago. Prior to that, I was a molecular biologist, and I worked for diagnostics company working with genomics and sequencing data. And as of right now, I'm working on models that will predict patient costs and also predict whether the patients will have chronic diseases, acute or no conditions. And this will better help ensure lower high-cost patients so that we can get them into programs to help treat and manage their chronic diseases.
Thank you very much. My name is Gutfraind. I work at a company called Blue Health Intelligence. You probably heard about the Blue Health system, the Blue Cross Blue Health system. So they're a network of insurance companies. So Blue Health Intelligence, where I work, is a very interesting shop. We basically take all the data that comes from all those insurance companies, health insurance companies, and build analytics on top of that. We have a massive database of data from claims, including over 100 million lives. And based on that, we're trying to basically make the healthcare work better, improve care, reduce, eliminate avoidable costs. I work at the strategy team, so what I try to do is help negotiate deals with different partners, providers, and insurance companies, and guide the development of new products informed by data science. Before that, I worked at a company called Uptake Technologies. This is a company that specializes in predictive analytics, especially for heavy industry, so trains, making sure that trains don't break down, making sure that trucks don't break down. That's the kind of work I did before. I'll be happy to also tell you about my research work and some of the stuff that's happening in the research team. Thank you.
All right, thank you. So my name is Erik Widman. I am a product owner at Solstice. We are a technology consulting company that works primarily with Fortune 500 clients. So I work primarily with artificial intelligence products. And a recent project that I've been working on is implementing a chatbot for one of the largest financial service companies here in the US to try to help them improve their customer service experience. So we've been trying to automate about 30 to 40% of their customer service traffic. This is going to help them offload their customer service agents, serve customers faster. It's going to save the company millions of dollars in 20 years. So that should be released later this fall. Prior to my work as a consultant, I was working in the biomed space for about 10 years. I've worked both on the hardware side, developing pacemakers, and also on the software side, working with image processing. So I was working on developing image processing algorithms for ultrasound machines, and have been very involved with computer vision. So you can say that my expertise really lies in computer vision, machine learning, and natural language processing. So I'm going to try to give maybe a higher level perspective on AI and data science today, kind of from the industry perspective, and what I'm seeing out there in the industry today.
Yeah, welcome. So, Ideas, we organize more than 10 conferences every year across the major cities. Healthcare, finance, e-commerce, and government data, they are all the major application domains for AI and data science. So I'm so glad that we have experts today for the healthcare. So can you guys share a little bit about how we can use AI, data science technology in healthcare industry? What is the trend in 2018? How we can use this kind of technology? I'd like to start from Erik.
Sure. I'll give kind of the macro perspective. So the way I think about this is, I think in terms of the healthcare value chain. So AI is really going to have an impact along every step of the patient journey, from picking up the patient with an ambulance, to treating the patient in the emergency room, to outpatient care, to medical billing. So just a couple examples of this, what we're going to see in the coming years. Picking up the patient, we can use AI to automatically direct ambulances to the least used hospitals where they have the least amount of patients in the emergency room, and ping the emergency room to tell them this type of patient's coming in that needs this type of medical treatment. When we're caring for the patient in the hospital, we can use things like blockchain, sensors, and AI to keep track of both patients, staff, hospital's assets, medication, and really optimize those patient flows and staff utilization in the hospital. We can use AI and data science on the medical billing side too, on the claims part, where we can look at things like medical claims fraud or overbilling, which is a huge problem for insurance companies. So we can look through millions and millions of medical claims, look for overbilling, look at medical codes, detect anomalies, and this can save medical companies millions of dollars. So these are just a couple of applications throughout the patient value chain where AI and data science is going to have a huge impact.
So, a couple of observations that I'm seeing at my end. I think that what is cool is that everybody in the healthcare industry is really trying to do as much analytics as possible, as much technology as possible, as much of the latest and greatest. I work at basically a type of health insurance, and we are constantly having conversations about blockchain, artificial intelligence, like the deep learning kind of stuff. Now, how far has this bandwagon gone? So what I see is that mostly right now, the main applications of all these technologies are an application that use machine learning. So that's as far as it has gone. So people are using predictive models to predict something, predict an outcome, predict, for example, a cost, like what Katherine is talking about. This is stuff that is actually implemented and it is being used by software that nurses are looking at. And it's really exciting because medicine is a humongous industry. 18% of the economy is healthcare, right? And if we can use artificial intelligence or some of those technologies to make an impact, I think it's really exciting. So what I'm seeing is, first of all, that everybody are excited, and secondly, that as far as the implementation has gone, people are implementing algorithms like predictive analytics, and machine learning, closely supervised learning types of algorithms.
Yes, I've seen similar trends as well. I focus mainly, as I had mentioned before, on reducing costs and improving the quality of care. Like Sasha said, healthcare right now makes up about 18% of GDP. we spend about $3.2 trillion or more on healthcare per year. It's United States federal government single largest expenditure. So this is a big problem because not only do we spend more on healthcare than any of our competitor nations, but we actually have the worst outcomes. So unfortunately, although we spend so much money, we're not seeing that in the value of care. In order to address this problem, we really need to use technological approaches, as these two guys have said. We need to use predictive analytics to prevent these diseases and manage them prior to them getting worse. And what we're seeing is that a lot of these patients that have not managed their illnesses come in, they haven't seen a doctor in years, and then they're racking up millions of dollars. When had that been addressed and had that been prevented, it wouldn't be as much of a cost, and the patient would be much healthier as well. So those are the main things I'm focusing on now. Like I said, I worked at, and I did my degree at University of Chicago. I worked with Dr. David Meltzer. He is a physician at University of Chicago Medical Center, and you can also look him up. He just had an article on his comprehensive care program published in the New York Times. So that was what I had built models for him to predict which patients at University of Chicago Medical Center were going to be, in the top 5% contributing to 95% of the hospital's costs. And we're also going to sick patients because he wants to put those patients into programs that will help them address these chronic and costly diseases. I'm also seeing that on the insurance side as well, as the U.S. is trying to transition from the fee-for-service. So historically, they've always paid for quantity, basically, which is fee for whatever the provided service was at the hospital, and now it's transitioning to quality metrics. So we're focusing on the quality metrics at hospitals, and again, with the insurers, they want to know the most costly patients are going to be the ones with the chronic diseases, so they can get them into those disease management programs. So that's what I've been seeing.
Yeah, so we had a small talk this morning about Catherine's work in the prediction for the patient's cost. Can you share a little bit about the more details about modeling you use for the prediction?
So I built recently 2 models for both ACA and MA markets. So ACA is the Affordable Care Act, and MA is Medicare Advantage. So the markets are a little bit different. For MA, it's a much more stable market, mostly with more elderly population. ACA is not very stable. You have a lot of flux and churn in that market, and very diverse population. So the models are a little bit different. I'll speak to my ACA new member model first. So what this model is that insurance companies, when they have new members enroll at the beginning of the year, they want to take a look at their history, their demographics, what plan they signed up to, what the deductible is, what the premiums are. They want to know what the socioeconomics of that member are, and therefore I can predict quite accurately what that member is going to cost them monthly, and also whether they're going to have chronic, acute, or no condition. And like I said, this is so mainly they can focus on those high cost chronic disease members. And in the ACA market, what I found to improve accuracy is actually also clustering prior to the cost models, because I find that there's very distinct pockets of members. For instance, there might be a group of members that are, from one state. They're wealthier, younger, a lot of, pregnant women that are high cost, conditions. And then there may be another population where they're from a different state. They're mostly older members. They are mostly like PPOs. They have a lot more chronic conditions. And maybe there's another population where it's all the lowest income people. They have HMOs, things like that. So I find that when I'm able to distinguish these populations and build separate cost models within each of those distinct populations, I'm able to predict their costs better. And, they seem to have a very similar trend based on their socioeconomics, based on their geography, and, previous conditions and all that. So I was able to predict quite accurately, and then as well with the chronic acute, very accurately as well when I clustered. For the MA market, I didn't need clustering to build a very accurate cost prediction model, because it's a little bit more homogeneous of a population. So those were a couple of the models that I built. I'm also building a survival model to predict what day in the year a gap closure will occur, just meaning that when will this person's condition be submitted as a claim by the insurance company, because they like to know the exact date, so they can predict that. So those are a couple of the models I've been working on, some of the trends I've been seeing.
How many of you guys have heard about the GDPD? Yes. Okay, great. So the GDPD, I think it could be one of the most disruptive events in data science happening right now. So if I'm not mistaken, that stands for Generalized Data Protection Directive. So, let me go back to healthcare and connect this to GDPD. So healthcare data is regulated by the government. Unlike other forms of data, there is a lot of restrictions to how healthcare data can be used. So this is the so-called HIPAA, that privacy rule, which basically says that patients have a right to privacy, and their data cannot be just freely shared to anybody who wants it. So data has to be anonymized, protected. There has to be like various kind of safeguards. So this is something that we deal with in the healthcare world all the time. So there's just a lot of restrictions, a lot of checkboxing that needs to be done, and also various technologies need to be implemented in order to safeguard patient data. What I find very interesting, and it goes to the question of trends, is the European Union has now implemented something called GDPD, which basically says that all personal data will be protected very strictly. So you've probably seen all this like announcements from Google and everybody how they're changing their terms of service. It's because of this. So this is like a massive disruption that's hitting, I think, the whole data science space. That personal data, at least for European citizens, will have to be protected on a level that's even more strict than I think we are now protecting healthcare data. Now, the good thing is that what I'm saying is that there's a lot of startups which are actually implementing interesting technology that allow you to provide assurance that you are actually protecting the data, that you have the right procedures, that you implement the training. So this is a very interesting trend that I'm seeing in the healthcare space that is affecting the larger data science base. One other thing that I want to mention about this, how many of you guys have, I like your relevant questions. How many of you guys have heard about CAR-T? CAR-T. So CAR-T is a new treatment for leukemia. It cures leukemia, and it costs $500,000. So think about this. So the numbers I've seen is a typical healthcare insurance policy is about $500 a month. So that's how much healthcare for adults costs. Now, imagine that there's somebody who needs treatment for leukemia, and leukemia could be treated now, could be cured. Previously a death sentence. Now it could be cured for $500,000. So that's going to be having a massive disruption for the entire healthcare, in my view, entire healthcare space. Because now we are entering an age where it's possible to cure diseases which were previously incurable, but it's extremely expensive. It's extremely expensive. So there's going to be, how is it going to be affecting data science? It's an open question, but it's going to be very much affecting the finances of the entire insurance industry, in my view. And nobody knows how to address this. So just leaving you with this destructive thought.
I have one idea how to fix that. Health regulation. Healthcare costs, that's a whole other bag of monkeys that I don't want to go into. What I do want to talk about, two things in terms of predictive healthcare data. I want to kind of look way into the future. That's what I like to do. So what I'm excited about is the use of blockchain in healthcare. And so imagine way into the future right now, 50, 100 years, right? The big problem that we have right now in the US is tracking our own medical records. So if you look in many different places, we're going to different hospitals, or healthcare records are all over the place in the US. We don't have a centralized system. With technology like blockchain, you can track your healthcare medical history throughout your entire lifetime. And moreover, you're going to be the owner of that data and can decide who you want to share that data with, what data you're going to be sharing with them. You can even do things like monetizing your data, selling it to clinical studies, and capitalizing on it. But what's even more exciting is to use that data that you now own and to combine that with machine learning. And to look at people's healthcare choices over their lifetime. So what are you doing in your 20s? What do your vitals look like? What are you eating? How are you exercising? And fast forward to when you're in your 50s and 60s. And now we can finally get a true cause and effect correlation between what you were doing early on in your life and the healthcare symptoms that you're seeing later on in life. So this means that we're actually going to finally be able to really understand the cause of diseases. And that's a big problem that I've experienced as a scientist, is that we make a lot of very generous assumptions in science. So AI and blockchain has the potential to really change the way we think in terms of healthcare long term. So that's really exciting. A challenge that I've seen in the near term is, so I come from the medical imaging world, and been working on very advanced medical imaging algorithms, and there's a lot of mathematics and a lot of physics that go into them. And even just to construct a CT or an MRI image or an ultrasound image, there's just a lot of assumptions that go into just to make the actual image. So there's a question in terms of how can we trust our data when there's so many assumptions in there. And right now, I think it's difficult. Doctors right now are a little skeptical of numbers, but imagine in the future, right? The kids we have today that are growing up with our iPhones and everything, and fast forward 40 years to when they become doctors. They've always grown up trusting what's on their phone and what they're given. When they start just trusting all the numbers that we give them through our MRI machines or ultrasound machines to predict a heart attack or stroke, I think there's a risk here of over-trusting the data, especially over time. And that's something that we have to be mindful as data scientists and people who work with artificial intelligence. So that's an interesting thought.
Yes, so I'm glad you mentioned blockchain. So we will have a blockchain leadership connection tomorrow. That is a preparation for our blockchain conference in August. We will have a blockchain conference in August in Chicago. So I remember a couple years ago, I was working on a healthcare project. It's called Real Vision. So we helped the hospital and the insurance company to do the prediction. At that time, it's kind of challenging for me because I came from AI background. So when I deal with healthcare data, it's kind of brand new. So I would like to maybe our speakers can share a little bit your experience, how you work with healthcare data. I think the data is the key, right, for healthcare industry. So how we can, like myself, a guy from different background, how we can deal with the data and how we can find the useful data for your project. Maybe how we can guarantee the quality for the data. Can you share some experience for our audience?
I'm going to let you start with this stuff. Keep it democratized.
You want me to start?
Yes, please.
Oh, okay. Okay, so you want me to talk about the data, I build my models? Okay. So like I said, I work for a consulting firm. We have relationships with most of the insurance companies. So we work with Medicaid, Medicare, data, and just private insurance as well. So we get all of their data, all their claims data. We also get all of the plan data as well. So all the member, the plan, the demographic data. We also use census data. And those are majority of like the data sets that I'm working on. We do have to clean the data quite a bit, so that involves aggregating a lot of different data sources. We use AWS and SQL relational databases, and then we import that into Jupyter Notebook. So we do as much cleansing as possible in SQL, and then do the rest of the manipulation in Python. And I also build the models in Python as well. One of the issues with healthcare data in general, as the guys had mentioned, is just HIPAA and privacy. So we have to be very mindful about not using any kind of names, and not anonymizing all of the members. We can't use the member IDs or anything like that. We have to go in and give them random IDs, before we start analyzing or building any models. Is there anything else you want me to touch on in terms of the cleansing?
So I know it's really difficult for us to find the data. So can you share some points where we can get the data for the healthcare project?
That's a great question. In fact, I find that I spend a lot of my days looking for data.
Mm-hmm.
So it's a problem that a lot of us have. Look, what is interesting, what I did not know before, is that there is a data industry. So there is a data industry. They're called, their evil name is the data brokers. There are people whose entire business model is to collect as much data as possible about everything. And what you can do is you can if you're looking for data, there are people who can help you. There are people who are collecting data about consumers in every possible way. There are people who are collecting data on voters in every possible way. How does this actually work? Well, so for example, there's a lot of public records. There's a lot of court records. So companies collect court records. Then when they go around and they go to employers and say, can you give us a list of all the people that work for you and their costs, for example? And so they put that together.
Be more resilient to new entrants entering this market, trying to make predictions on cabbage fields. They won't have as much data as you, their models won't be as good, they'll be more defensible in the future. So all this data that we're collecting today, there's a huge strategic advantage for companies to be the owner in any given segment of data. So remember that when you're starting your startup, okay?
Yeah, so thank you for the sharing. So I think UCI, University of California at Berkeley, they also have a huge data vocabulary. So about fintech, healthcare, if you go Google, you can Google there. Cool. So I think before we come here, we collect some questions from our previous attendees. They were interested in how we can use data-driven marketing to growth hacking, help the company, either large company or startup company, to grow their user base or promote their product. I think we use the same technology in healthcare industry, right? For insurance, for those people. Can you guys share a little bit, your experience in this domain?
I'll go a little wider than just the healthcare industry. So I think the advantage of all of this data, especially in market applications, is really segmenting your customers and really narrowing down who they are and what they care about and what their emotional responses are, what triggers a buy, in terms of the sale. So this is really valuable in terms of any kind of marketing, as in terms of social media. And I think that for any company that's, any new company that's making a new product, having a data-driven product is going to be essential to surviving in the next 10 years. If you're a startup that is not making a data-driven product, it's going to be very hard for you to compete in the near-term future. And like I previously mentioned, I think that data really makes you indefensible or defensible to new competition. So I think that's really important as well.
Some of the marketing is a fascinating area. I remember it was at the presentation where from a chief marketing officer for a financial company, and they did something that I've never seen as a data scientist, but I think it's very cool. They started with a large data set of consumers, and then they marketed the product to a random subset of that, and then out of that population, a certain fraction actually bought the product. So now they basically had a supervised learning problem. Their next step was actually to build a model that will predict, based on the people who bought, to predict who will buy. And then they could do a larger campaign, which is going to be specifically targeted to the people that their model predicted would buy the product. That's a very interesting use. So it's a combination of machine learning and data collection that's going on in the marketing field. Obviously, marketing is a field that's driven by data. And one thing that a lot of people in the startup world do is, of course, like those vanity websites. Have you guys seen those vanity websites? So basically what you do is, let's suppose you have an idea for a product, cabbages. You want to sell hyper-organic cabbages, right? So what you do is you create a one-page website that says, buy my cabbages coming in 2020. And then you run, go to Facebook. Have you guys seen the Facebook business portal? Yes. So yeah, it's just fascinating to see actually how Facebook makes money. And you can open an account for Facebook Business, and then you can say, I'm looking for to place a particular ad for people who are in this age group who live in a particular area, and then I would like to also select them. I think that liberals would be the ones who buy my cabbages. So you could micro-target your ad, and then see how many people are going to click to that ad. And that's fascinating, and it's a very powerful technology for startups, because with like maybe $50, and I've done this myself, with $50, you can figure out if people are going to love organic cabbages. Before, like, you plant a field and genetically grow everything, fertilize, grow those cabbages, you could go on Facebook and find out if people care about organic cabbages. So marketing is an area that's really powered by data science.
Yeah, I agree with what both of you all said. Yeah, my idea of growth hacking is, especially important with startups because you want to bring a product to market as quickly as possible and use different marketing tactics that are inexpensive. I can say that I've been with a lot of retail companies who use the segmentation methods and a lot more of the sophisticated methodologies. I think at the very basic level, what I've seen is more like controlled studies, so A/B testing. My company right now, for instance, has been working on evaluating email campaigns. So, we have a control population of physicians who did not receive the email. And then we have the test group who's receiving an email about, hey, these are your patients that have these diseases. Make sure that you code them so that they can get that reimbursement back from the government. And then I'm kind of studying these two groups to evaluate the success of that campaign. So normally we like to have these smaller pilots before we roll out, a large product. If I find a statistically significant improvement in these physicians who receive the email coding their patients correctly, then this might be, a product that we want to invest more in and roll out. So those are, some of the ways that I've seen as a very first lower level method, and then second level, I think that you develop the more sophisticated clustering algorithms to target and segment your population from there, and then evaluate the success within these different segments. Just one more thing about the growth hacking as well. I think that what I've seen with startups, just in terms of marketing, using a lot of viral marketing as well, has been very successful. So, with Twitter and LinkedIn and all that, rather than, some of the more expensive, like TV commercials and all that. So.
Actually, we use Facebook a lot. For this Chicago conference, I think I'm looking for my colleague. He spent a little bit, budget there. In 2 weeks, we reached out 200,000 people about AI and data science. So, okay. So at the end of our panel, I would like to pick up 2 questions from our audience. Okay. Okay, let's go that further. Okay.
So my question is, are there any kind of studies or anything in healthcare that basically studies the past? Because a lot of times when people talk about healthcare, there seems like there's a pattern where they're always studying or doing research on the negative side of healthcare. My question is, do you guys know, or do you guys do any kind of studies that talk about what the people that are healthy, what they're doing right, so that you can apply those to the people that are doing it wrong as a prevention method? Does anybody ever study what people are doing right versus what people are doing wrong?
Can you repeat the question?
Yes. So the question is, does anybody study what people are doing right versus study what people are doing wrong in terms of healthcare studies? My point of view, I think this is a question of, is the glass half empty or half full? In a lot of research studies, we talk about outcomes, trying to always improve healthcare outcomes. From my point of view, that's positive. But in terms of what you can do right, most medical studies always come back to the same thing. Don't smoke, don't drink, eat healthy, work out. And this is why I'm a little cynical towards the healthcare industry, having been in it for so long. All of our healthcare problems, heart disease, stroke, cancer, everything comes back to those 4 things. Then of course there's genetic disposition. Some people are genetically prone to getting diseases. There's little to do about that. But we're also exposed to environmental factors. If you live close to a factory, okay, if you're concerned about your health, move. Health isn't really rocket science. I've done a PhD in the subject. I'm telling you, there's 4 things you can do. Eat healthy, work out, don't smoke, don't drink, don't live next to a factory. You'll be really well off. So that's my positive the answer about healthcare research. What else?
I think that one of the areas that we're actually investigating right now, so I have the products that I'm working on that are viable products that we already know we have customers for and that we're rolling out. We also do a lot of research and development as well, and what we're looking at is like mental health a lot, because there is a correlation between people that are happy, have good mental health, and don't get many diseases and are much healthier than those who don't have depression. And a lot of these chronic diseases we're finding are highly correlated with mental health. So really, as the guys were mentioning, healthcare trend is moving towards like this 360-degree view of the patient. So it's not just about, hey, what did like the heart doctor say or this or that. It's about what did their psychiatrist say? What is the notes about like all the doctors, so that you can have that 360 view of the patient. And yeah, that's one of my observations.
Yeah, I think we are running up. Go ahead. So we are running out of time. So last question.
My question relates to, I'm still within the topic of healthcare. My question relates to the politics of data science in the healthcare setting. There was an article in the New York Times, I think 2 days ago, which basically talks about doctors being now admins,
Like comprehensive care.
Right, like medical workers.
Yeah.
With this, EHRs. So when I read the comments, it was just very, very much almost all doctors, and they were so against this whole trend of data science. So as we're moving to this new age, clearly, you've got all of these old doctors from the old school. How do you deal? How do we deal with this problem of clashing against these old dinosaurs?
Yeah, we find that all the time. That's one of the biggest issues that we have in healthcare. It's mainly the doctors who have, egos, I guess, and they've been, doing what they've done for many, many years, and they just feel like, well, I've always done this. That's like what they say. Like, I've always done this, and it's always worked, so why should I change? And we get that like very, very frequently. So we just have to find somebody who's going to side with us, and there are, doctors as well who do agree that data science and technology can help them come to better decisions. And we just have to get those people on our side to then, help us influence the people who are kind of against us. So.
That's an excellent point, and something that I wanted to bring up during our discussion. So the healthcare industry is extremely resistant to change. This is because of historical reasons. It takes a very long time to become a doctor. Medicine has a long tradition, and doctors are very worried about making changes to what they're doing because they're worried that if they change something, they might kill a patient, right? So because of this, healthcare is actually going to be one of the last industries to fully adopt AI and data science. The industries that we see that are leading the space right now are financial services, followed by manufacturing and insurance industry, actually. The healthcare is going to be one of the lagging industries for that reason. Now, how is this going to change? So, once again, fast forward about 40 years from now. So our kids that are growing up now with all this technology, they're a whole different generation that are going to be used to playing with technology, smartphones, and data. And once they become the doctors, I think they are going to be much more open to change. So I think there's just this, we have a generation of doctors right now, and we're not going to convince all of them. So this is kind of a waiting game, unfortunately, to see the kind of change that we all want to see.
I'm sorry, I have not read this article, but you know, I think if you're asking about generally how do we make change in the healthcare industry, and what is the right balance between like experts versus data, I have to say that even though I'm a data scientist, I think that there is a very important role for the practitioners to play in making the decisions, and the patients themselves. You know, ultimately, even in this data euphoria, our data is going to be limited. We will never know the full picture with all the data. We'll never know what's inside the patient's head, for example. We'll never know. Never be able to. I don't think we will ever be in a place where we can observe as much as the doctor observes of the patient. So if that is true, if you're only seeing, if all the data that our algorithms will ever see is maybe 50% of reality, that means something. It means that we should not view our algorithm as prescriptive, but rather as some kind of an aid to the doctors, an aid to the people in the field, aid to the people who are actually have maybe sometimes more knowledge. Sometimes those people have biases, and this is really unfortunate, and sometimes they have professional resistance, for sure. But I also think that we should be humble as data scientists and say our algorithms are not all-knowing, and they should be designed as a complement, as an aid, rather than like the ultimate oracle.
Okay, cool. So again, thank you for all the speakers, and